HBS Final Project. Jimmy W. Neutron, born on July 23rd of 1995, recently traveled to South Africa in hopes to get away from his real life for a few weeks. He left his home in December of 2020 after Christmas and returned in early January. Shortly after his return, he began noticing that he had some pain in his chest. He was also having difficulty sleeping. He admitted to feeling excessively hot throughout the night and reported having a fever since mid-January.
Since Jimmy had been feeling sick, he decided to give his primary doctor a call and pay him a visit. The primary care physician's main job is to help manage a patient's health by providing routine physicals and checkups. Another part of a physical care physician's job is referring patients to appropriate specialists based on the nature of the health issue. They're able to request or perform diagnostic tests and make diagnoses as well. While at the primary care physician's office, the doctor noticed issues with Jimmy's lungs, and along with his symptoms, the doctor thought he may have a chest infection, restricting his airways and lungs. He referred Jimmy to a pulmonologist to take a closer look at his lungs.
A pulmonologist is a medical professional who specializes strictly within the lungs. Their main goal is to provide patients with ongoing care for chronic conditions such as asthma, lung cancer, chronic bronchitis, or pneumonia. With Jimmy's lung issues lately, it makes sense for him to see a pulmonologist. When seeing the pulmonologist, or he saw, but when seeing the pulmonologist he saw was testing him, he noticed that Jimmy was also having issues with breathing and he was coughing up mucus and blood. On seeing this, a pulmonologist became concerned. He ordered a TB skin test in hopes to just rule out the disease. Normally, a tuberculosis skin test requires 2 visits to a medical professional. On the first visit, a nurse or other physician will insert a needle with a small amount of fluid called tuberculin into the lower part of the arm. The skin in the area of insertion will be raised after due to the insertion of the fluid. After 48 to 72 hours, a person will return to the facility of the medical professional who performed his or her test so that professional could determine the results of the test. In a positive skin test result, the fluid administered 2 days prior would still be present and the skin would still obviously be raised. Irritation or swelling in the location of the test would be another indication of a positive result. A measurement of 5 to 10 millimeters also indicates a positive result. A negative test for a tuberculosis skin test would look like nothing was ever inserted into the skin in the first place. The skin would appear flat, and no evidence of tuberculin fluid would be present. However, the results came back inconclusive. The final measurement in the area of insertion was 4 millimeters. Not quite positive, but not negative either. Because of the inconclusive results, Jimmy's pulmonologist ordered a tuberculosis blood test as well. Normally, only a TB or uh, TB skin or blood test is needed because those tests only show if a person has been infected with the tuberculosis bacteria, but does not show if a person has latent tuberculosis infection or has progressed to the tuberculosis disease. In order to get blood drawn, Jimmy had to go to a medical center. In the medical center, a lab technician drew Jimmy's blood and then mixed it with the activated antigens of the TB bacteria. When the pulmonologist got Jimmy's results back, he informed Jimmy of the positive result and then referred Jimmy to an infectious disease specialist.
Infectious disease or physicians have extensive training in internal medicine and specialize in the diagnosis and treatment of infectious disease. They focus on how diseases spread, how the body fights them, and how to control them. They usually take cases referred to them by other doctors. Infectious disease specialists will review a patient's medical history, including records, x rays, and laboratory reports, and proceed to make diagnoses and provide care for patients who are at high risks for secondary infections. When Jimmy got to his infectious disease specialist, he informed the infectious disease specialist that he has been struggling to breathe without having any pain. Immediately, a chest x ray was ordered. The chest x ray showed many light areas of pot,
Opac-
apis,
opacities.
opacities that run together in the center of the lungs. These light areas are signs of tissue death within the lungs. He was diagnosed with the tuberculosis disease. Jimmy was then discharged with a prescription of isoniazid, I don't know how to say that, which is a common drug used to treat tuberculosis.
Um, Jimmy lived painfully for about a week after he began coughing up blood and decided to go see a critical care specialist. A critical care specialist will diagnose, treat, and take care of critically injured patients, particularly trauma victims and patients with multiple organ dysfunction. They work closely with patients and the families of those patients in high stress situations. They're usually the first to interact with the patient's family post diagnosis. Therefore, they need to be compassionate and have good communication skills in order to comfort and inform family members. When Jimmy arrived at the hospital, the critical care specialist came to treat Jimmy. He decided to order a CT scan to see how much Jimmy's disease had progressed since his chest x ray. When the results came back, it was clear that Jimmy's tuberculosis had gotten worse since his visit with the infectious disease specialist. There was evidence of many um, centriobular
Yeah.
um, nodules, brachial lining opacities, and patchy consolidation. At this point, the critical care specialist wasn't sure if Jimmy was to live or not. Typically, the preferred regimen for treating results with TB remains a regimen consisting of intensive an intensive phase of 2 months of isoniazid and three other drugs, followed by the continuation phase of 4 months of isoniazid and rifampin. But because Jimmy isn't in good condition, the critical care specialist decided to make him as comfortable as possible for his final days.
So, statistics: more than 1.5 million people died from TB in the year 2020. Tuberculosis was first identified on March 24th, 1882 by scientist Robert Koch. Cases date back to the early 1700s. In England during the 1700s, it was thought that the royal touch could heal a person from the king's evil. Roughly 10 million people fail or fall ill to tuberculosis each year. About 15% of those that contact the TB disease or contract the TB disease pass away each year.
These photos show Jimmy's lungs in the final few days of his life, clearly covered with white lesions and other damage. Jimmy W. Neutron passed away on April 20th, 2022.